Do you have the angle for when we're sitting here? Later you will change, is it?
Later I
Oh,
have to
okay.
change.
Oh,
Oh, sorry.
just let me know. We live? Already?
Yes.
Okay, that's good. That's good. Hello, mummies and daddies. Thank you for joining us today on Mummy's Market Live. Sorry we're a bit late, but we are all prepped here and I'm very, very excited because today we have Singapore's favorite baby whisperer, Dr. Wong Boh Boi. Welcome, Dr. Wong. Thank you for being with us today.
Thank you for inviting me. Hello, moms and dads, and all the babies out there, or babies to be coming out soon. So it's very important today. Actually, I'm a founder of a Parentgraph, right from overseas UK, where I was originated from, to here, and then we actually have a special program to take you through from prenatal, and then help to actually prepare you for labor. So to at least you enjoy your labor, and then postnatally able to handle the baby and able to enjoy that journey together with your baby. So it's very important. We have a very specially design program for parents, right from actually even not only you and your husband, also for the helpers and also for grandparents as well.
So I think parents from different stages of parenting will always come and look for you for every single thing that you can imagine about parenting and pregnancy under the sun. And that's why we are very, very honored to have you, Dr. Wong, because today we are actually going to look at some bath techniques and tips. And Dr. Wong is also going to share with us on diapering, and we're going to address many questions from you mummies that you have written in. Thank you so much for that. Once again, I would like to say thank you to our sponsor for this segment, which is MamyPoko Natural. It's the first organic diaper in Japan. And also, just a very special note for all you lucky viewers out there. We have 3 lucky draw prizes to give away to 3 lucky winners. All you have to do is like and share this live session with Dr. Wong and our diapering section. All you have to do is just like and share. And number 2 is comment what you like about the MamyPoko Natural diaper. Just name us one key feature. And 3 of you will be walking away winners tonight with a carton each of MamyPoko Natural worth $104. So remember to like and share and leave us a comment on the live video as to your favorite feature of the diaper. Alright, so once again we are with none other than Dr. Wong Boh Boi, senior Parentcraft specialist and lactation consultant. I think you've done everything from pregnancy to parenthood for parents. She told me that you used to deliver babies in the UK, midwifery.
That's right. I used to actually handheld all the students, and my education is actually, you call them educator and the clinician. So to walk all the students through, right from nursing student to midwifery students to even medical students. So, all these are sharing. So today I'm going to share, very, very delight to share with you any questions you have on the ground. Don't worry, every question to me is very important.
Okay, let's just see if a lot of mummies and daddies are coming in. How many do we have now? Okay, fantastic. Okay, I think since we are a little bit behind schedule, maybe we'll just start on first.
Yes.
And then we'll repeat some of the key features so that the mummies and daddies who join us at a slightly later time will still get some nuggets of information from our very wonderful Dr. Wong. Okay, so Dr. Wong, here we have our baby on our Mikuna changing table. So can you just walk us through the starts of the bathing process?
Okay. Before you bathe the baby, because it's need to organize. Make sure you got organizer. Make sure your diaper, your change of clothing, your wipes, everything is ready.
Okay.
I don't want you to be halfway running around to look for things. So comfortable. And dress yourself comfortable, make yourself comfortable. Choose a time that suits you rather than suits everybody.
Right.
You and your baby is most important. And then father, it's good to learn as well. So in my class, I always encourage father to bathe the mama and the baby, and the mama just watching.
Okay. Oh, not bathe the mama. Okay.
Bathe the
That'll
baby.
be nice. That'll be nice.
Why not? If you have cesarean section, you definitely need your
some
husband
help.
to bathe you.
Yeah.
You need your husband to help you
Right.
to get out of the bed and then get a shower and things like that. Okay?
Okay, so daddies have a very important role to play.
Of course.
Yeah.
Most important of all.
Okay.
And then you learn a lot of fun as well, and there's a lot of enjoyment. Right? Enjoyment, and that is important. So key point now is very important. Today we just do a quick demo.
Yeah.
Very important, we have to make sure the tubs are clean and wash clean and your hands are clean. And hygiene is very important. If I got dirty hand, everything will be contaminated.
Right.
So
Okay.
I naturally all scrub already using the hand steps of basic steps of hand scrubbing. After that, if the baby's got sticky eyes, very important, you actually can do football holding. That is called football holding.
Right.
And you can actually pick up the cotton wool, squeeze the excess water off, and you clean the baby, look at the baby, and then say, I'm going to clean your eyes. Always seek for permission. Don't do it because for the sake of doing. Right? If baby got sticky eyes, just say they will be very clever to close their eyes. So they close their eyes and you just clean and discard. That's all. So if the other side need to, we just repeat the other side. After that, we wash the face. So generally, I do not put anything in a water first. Because I need to clean the face. Just
Right.
generally tap water from the shower.
Right.
And then if you clean the face, I'm going to get a towel to show you. Yeah. So basically, we also clean the face. This is a wet towel. I just clean his face. I do the clean area first.
Do you
After-
put soap on this or it's just normal tap
normal.
water, right?
Then after that, I may just use a towel. Okay. I make sure I'm very organized. So everything is within my reach.
Alright.
I always can pick it up and then that.
Right.
Okay, done.
Okay,
And
that's
then next, if I need to do is doing the hair.
Right.
So what I have to do is I open up. This is a beautiful, gadget.
Yes.
And everything is in one go.
Yeah.
So no need to fetch water, running here and then changing that. If your house is not very big, and this is ideal. So after that, you put a drop of a baby bath.
Yeah.
Why baby bath is important is actually soften the bath. Then make sure the water is deep enough, and the temperature you must check with the wrist and also the thermometer to make sure it's about 37.
Right. So this is one of the questions that one of the mom is asking. So basically, one of the mom is asking, does she apply the soap directly onto the baby or does she just pump into the water?
Only pump in the water. Try not to put too much. Baby doesn't like bubble bath. You also create of what we call sensitivity. So one drop is good enough to double up, and you do not need to rinse it off. That is important part of it.
Yes, that was another question. One of the mummies wrote in is, do I have to wash off or rinse my baby after I take her out of the soapy water?
Yeah.
Yeah, so because like what Dr. Wong has mentioned, the water is very diluted because you
Yeah.
only just put one pump of soap. So actually you don't need to rinse off the baby again.
Yeah.
Okay.
So what you do is make sure you check your temperature. And our football holding, I support the neck. My hip actually grab the baby, so the baby is secure. So I wash the hair, I splash water on the hair, and then I will do a bit gentle rubbing. If you like to use a cloth, it's perfect. Do a circular motion, and you say to the baby, I'm washing your hair. Always talk to the baby when you bathe the baby. Never just like pretend you're a robot and keep silent and washing the hair. Baby will get very scared. So it's a bonding, it's a contact. eye
Communication
contact.
also,
Correct, yeah. You're telling the baby you're washing his hair. You can even sing. Okay. After that, you actually can dry the hair. So it's good like Jen is doing, is put a towel here. Basically, it's very easy. Understand?
Convenient.
Okay,
Yeah.
so the top, if you need to, do the clean first. Then if after that, we will put this back, or sometimes there are two ways of doing it. I can do everything in one go, change the diaper, strip the baby naked, then only cover the baby up. Then the difference is that I will swaddle the baby up loosely, and then before I do the eyes and the head. All follow me?
Yes.
All right. For now, example, this baby already clean and already stripped, and then the baby, then you actually can do the eyes, the face, and the hair, and after that you can put the baby in a bathtub. So to put the baby in a bathtub, it's very important you actually hold the baby this way. Support the neck. Stability is very important, and safety comes first. You actually lower the baby down in the bathtub. Sit the baby down, or baby can sit. Then you lean the baby forward, and then your thumb support his shoulder, forefinger under his armpit, and the wrist take his chin. If you got a watch, like to take it off, that is fine. And then you lean the baby forward, and then you actually go back, and then like a sandwich, then put the baby down. So this is called security, and the baby feel very secure. After that, you can put a cloth there to make sure the baby is secure, and that's it. And you pay attention with another cloth, clean the creases of the neck and the armpit, then the groin. Then after that, any creases you need to clean with the cloth. After that, it's super easy already. Just wash down the hand like this, the other hand, the legs, and with the finger. All baby are tight fisted. You must wash them, and because they got a lot of dead skin. So I'm teaching you a trick. All you do is put your thumb there on the back of the hand, and you draw 3 circles, and then the baby naturally will straighten or stretch the fingers. Then you can count 1, 2, 3 all the way down. Very fun. Then that's what you do, and the genitalia part will be the last part. To wash the back, if you are actually by yourself, you are not confident, you just lean forward and you wash his back like that. But I like to show fathers a special technique called the spa that is very important for all the benefits, and also most critical is, help to soften the what we call the mucus in the nasal nostril there, and then easily extracted after the bath. Because otherwise, when baby is born, they actually will get a bit sensitive, and then because now they from the water world into air world, there will be little bit of mucus. Then because they're in the air, they dries up. It's very difficult to remove. So night time you hear the baby snoring away, like unable to breathe like. So you go and see a doctor, and doctor give you some nasal spray or nasal drop like saline. Have you ever had saline drops in your nose? It's almost like drowning. So this is an alternative way to actually soften the mucus. I show you. Okay. Support. You put the temperature a little. Support the chin. Can you see that is very critical, gentlemen? You got to have the strength and the correct technique. Lean the baby over, pick the baby up from the bum, and this is, we just show you like that. Pick the baby, and then you flip the baby over, and the baby actually stay on your wrist. And then the water is a little bit warmer, 37.5, and you can see the steam actually help to soften the mucus, and that's called the spa. Then you may put a cloth on his back, and you enjoy it very much. Right? If you want to see the live video, of course I have the live video. You also can view as well. It's much easier. This is done. After that, to turn the baby back, you just put the baby back, and then back to original position. Then you wash the genitalia, center, side, and then the bum is done. Then we take the baby out. Then we put the baby on the changing mat. Sometimes we may use a base, right? So we put a base. Basically it's quite easy. Don't panic. Baby temperature will remain 37 because he's come out from a 37 temperature. After that, we use this and cover the baby up. See, Jen? Very easy.
Very easy.
So like a spa. Then we do the neck creases. Picture up this way, mother, and dry the creases of the neck, and then the armpit, and the hand, then you cover up, like in the spa. Do the armpit and the hand, and the rest is quite easy. Make sure the groin, everything is dry, and the back of the legs, and then behind the ears as well. And you just cover, baby, and it's much easier. After that, you do dry the feet. After you dry the feet, baby got the most beautiful scent. First month is rare. The feet. Kiss that feet. Don't wait until 6 months later, then will be just as smelly as yours. That's all. Okay? And the baby is just dry. It's very easy. They do dry very fast. Then we proceed to change the diaper.
Okay, Dr. Wong, sorry, we have one question with this part here.
Yeah.
Somebody is asking, a mom is asking, how often should I bathe my baby?
Oh, good
Newborn,
question.
especially newborn.
Because the only baby doesn't bathe, you no need to bathe, is NICU baby. That means they're too ill to be bathed.
NICU baby is that means
Neonatal
premature.
intensive care
Oh,
baby
intensive
unit.
care. Okay.
They're too ill to be bathed. And those are baby, because they never bathe, they're very prone to infection. So that's why you need to bathe the baby. And then it's the second reason why you must bathe the baby, because once the baby is out, then you're putting them back to the womb. It's water therapy. So the next day you can actually start bathing the baby. You don't need to wait for the umbilical cord to drop off. So it's very, very critical that you bathe. And the bathing, not only cleansing of the skin, at the same time, it also help the baby to relax and then prevent a lot of rash. At the same time, also is a form of a concept of science, because water-based.
Right.
And then science start from there.
Because 9 months in the water as well.
Correct.
So
and
they like
back,
the water.
Yeah, then they're back to the water and they relax and they sleep better. Alright. So example, you whole day, you don't have a shower, you also feel a bit uncomfortable, especially with the Singapore weather.
I see.
Okay?
So is it okay, so yes, babies should bathe. So if we bathe in the morning, do we also bathe in the evening? Twice a day.
Good question, Jen.
Mothers always ask that, yeah.
When you bathe the baby, I'll do a thorough bath in the morning. But I'll do a spa in the evening.
Spa.
That means
sounds very nice.
that you don't need to wash the hair anymore.
Okay.
You just generally wash the face and then you just focus down below. That means let the baby soak.
Oh, okay.
Yeah, like once you soak and then the baby never got diaper rash. And baby sleep much better.
Right.
If you do a spa at night.
Okay.
Yeah.
Okay.
So twice a day, ideally, one soap and one proper bath.
And a mom is also asking, should you use soap to bathe baby?
Soap is very important, especially where I come from, Manchester. The water is very hard water, so it actually dry your skin.
Right.
So what we do in overseas, and then we put a drop of a baby bath in to soften the water. So it's less harsh on the baby skin.
Right.
Baby skin is very, very, less resilient compared to adults.
Yeah.
And they're very sensitive as well. So because of this, that's why we have to take special care on the skin.
Okay. Let's move on to the diapering. I think we even have some umbilical cord questions as well. The cord stump.
Yeah. The cord stem, as they say, you give me a cotton, I just pretend to show you. Right. A cord stem, usually when it's born, it actually is nickel Walton jelly, they're patent. But half an hour later, they actually soften down. The Walton jelly melted. So the cord become like a soft cartilage. Then the next 3 days become hardened cartilage and they flatten down like this.
Right.
So there are many ways of cleaning the umbilical cord. So what you have to do doesn't mean the cord is on, you bathe the baby, the water will zoom in. There's no such thing. Basically, there are 3 forms of cleaning the cord. You're either using a dry cotton wool, sterile cotton wool, must be sterilized, and then you actually, after baby come out, you just dab it.
Right.
And you pick on it, and then you dab between the joint, right, the skin and the cord stem. After that, you throw away and you dry the stem, then you throw away and you dry the top, and that's it. Or you can use medical swab. The
alcohol
injection,
swipes
that's
that
right.
sometimes the PDs will also give out, and then use it to wipe around the umbilical stump, the cord stump.
That's right. That is what is most commonly done in Singapore.
Yes.
And then, or you can use cord spirit, which is very rare now. Okay. And the cord will drop off basically from 6 to 10 days.
Right.
Yeah. So you no need to worry.
Okay.
And of course nowadays I have one case. It dropped off on day 2.
So fast?
Yeah.
On day 2.
It was shocking to everybody.
Yeah.
And then on top, now I find more baby, the cord never drop off until 21 days.
Oh, even longer.
Yeah. You know why? Because now we got good antenatal care, so the cord is stronger.
It's very strong, right? Okay.
Like
so
the roots of a tree, healthy tree.
Very healthy.
So,
Don't want to leave. Don't want to drop off.
that's right. Yeah.
Okay.
So that is what it is. All right.
Okay.
Now, what we're going to do? What we're going to do now is what we call, some mom like to, just cover up. You don't need to rush. Diaper care, cleaning is very important. If baby bum is dirty, you have to clean. All right, cleaning itself is got a special technique.
Yeah.
So what you have to do, when you actually clean the baby's bum, it's very critical that you've got to actually, if it's little girl, you have to part the labia. All right. And then if it's poo, then you wipe from front to back. Discard, then you actually wipe the labia, front to back, then front to back, and then the groin, right back, and then groin, and discard. And then what you have to do, lift the legs never too high, okay? Because you injured the back itself.
Oh,
so it's
the back,
the
okay.
upper back. So never more than half an inch, go in and then wipe the back.
Right.
And last is the anus. Right. For little boy, what you do is similar. If the penis got no poo, leave it alone. And if got poo, you wipe it. After that, you hoist the scrotum because you definitely have to clean the scrotum. Just 2 fingers go in like that, clean the scrotum, discard. Then after that, clean the groin, front to back, discard, clean the groin, front to back, and then similar for the back. Right, lift it up, clean the back, last is anus.
Okay. So anus is always last. I think it's the same for adults, right? You will clean, front to
Clean.
back. And,
So,
yeah.
you're right, Jen, very important is the genitalia must be clean first. When, like surgical wound, we clean from inside out.
Yeah.
Not outside in. I have a patient actually, the baby was very frequent UTI.
yes.
She was cleaning in the wrong manner. She actually cleaned from outside in.
The
You're
confinement nanny, is it?
Yeah,
Or,
correct. So they're maybe confused or sometimes they forgot. They actually clean from outside in. That means you're bringing the germ to the baby, and that poor little baby was admitted many times with UTI.
Right. I think that's why Dr. Wong, you're always telling me that parents should actually learn the basics on how to take care of the baby and not learn from confinement nanny.
Correct.
Because confinement nanny may bring wrong techniques. Of course they don't mean any harm. Usually they mean the best, but it's always best to learn proper parent craft skills and taking care. That's why Dr. Wong always encourages parents, especially new parents who have never taken care of baby before, to always attend her classes so that she can actually guide them, and then you can actually guide the nanny
That's
on
right.
the correct techniques. I think it's about the techniques. You're always talking about the techniques. Right?
A lot of time, moms out there and dads out there, even ama, confinement nanny, they're very kind, but the techniques are all hand me down. So it's your caregiver. So it's very important that you update them. So it's called sharing. So in this world, we are all working as a team, further protecting that child from infection, not unnecessarily. Otherwise, baby, when it's ill, they do cry a lot and they cannot sleep, cannot drink. Like you, when you're in discomfort. Wow, there's a lot of questions here.
Yeah, a lot of questions. As always, Dr. Wong always has a lot of questions.
Okay, mom
to
and
answer.
dad, do you hear me out? Okay, and today is a very informal and it's a very casual session.
Yes, don't worry, we'll get to all these questions.
Yep. So what we have to do next is very important. Is after you clean already, you can sanitize your hand because of E. coli. All right, sanitize your hand is all right when you're actually dealing with diaper. All right, if you are breastfeeding, definitely go and wash your hands. If it's soap and water, because any chemical that can alter the smell, you see, of the skin.
The skin.
Yep.
Okay.
So if mom like to apply cream, then they may.
Yes.
Then what you have to do, any cream, baby actually when they got naturally got a little bit of barrier.
When they're newborn.
You notice the first 3 days, Jen, in the hospital, nurses never apply anything back after changing diaper.
Yeah.
But as soon as you take the baby home, remember baby pee and poo can be 8 to 10 times a day. All right, and then because the cleaning and you keep washing, the genital barrier around here is gone.
It's gone,
so
right?
you can apply some barrier cream back.
Okay, so this is one of the questions that mummies also, I saw quite a few questions written in. Is number one is, do we have to apply diaper barrier cream at each diaper change? And then also, I think we have some mummies who are asking about whether they should apply moisturizer.
Moisturizer is for
body.
lotion and moisturizer is for the skin. Example, baby got very dry skin. Some baby from a water out to here, they start flaking and they're very dry. Sometimes they can even crack. So what we do, we can use oil, baby oil. We can use lotion. We can use any balms or whatever. It's fine.
Right.
Yeah.
Right, and I think to also help to prevent further diaper rash, because like you mentioned, the barrier is already been
Yeah.
wiped away, so you apply diaper cream. And also I think it would be good to look out for good high quality diapers like MamyPoko Natural here. So Dr. Wong, this is a new launch in Singapore. We have this a MamyPoko Natural. It's actually Japan's first organic diaper, and it's made with an organic cotton top layer, so it's very soft and breathable. And there are also a lot of special features that come along with the diaper that I will share with you later. But the good thing is that it actually has 3 natural plant oils. It's actually jojoba, olive, and rice bran, and it's also made with additive-free ingredients. Yeah, so this is like, diapers keep upgrading and upgrading. So I think this is like the most premium diaper in Singapore right now. And of course, sorry, I just wanted to mention that because here we are talking about something very natural and very safe and reliable for baby's newborn skin. So obviously, for a diaper brand, you would want to, in general, you would always ask parents to look out for something that's breathable, that's soft to the baby's skin, right?
I look for diaper which is light, very absorbent, and very soft to touch. And most important, got to be very comfortable.
Yeah.
And then the baby actually can soak out a few pee, and then that indicator is well indicated.
Yeah,
So mother
which is
can have a
good.
quick pee, and then it's much easier.
Correct. So actually for this MamyPoko Natural, okay, before we wear the diaper, let me just show you. It actually has this wavy absorption zone behind here to capture all the loose stools and the punamis from the baby, especially breastfed babies, because breastfed babies have a lot of, it's very like explosive lah, the poo.
Correct.
Right.
Can even squirt all the way there. For baby boy, they can pee all the way back to Jen.
Oh, I like that.
Yes.
Okay, sorry, I have 2 girls, so I have no idea how. I'm sure you mummies with boys out there can can attest to this and have your own stories about like the accident. I think that's why when they're changing, they faster like close first and do some.
They
other
put a
things,
tissue
right?
on top. So that baby will not pick it up, especially baby boy. Like
Right.
a fireman picked up the fire, like a fire water hose, and they hose it everywhere.
Right,
Okay.
right. Okay, so anyway, this one is for the small and the medium sizes. It's a newborn and small size, sorry. And then, like you were mentioning about the indicator lines, this one has 3 wet indication lines. So what we can do is, you don't have to open up the romper and check.
Yeah.
You just lift up the romper from the side, and then you can see if it's coloured, means it's time for a change. That means the diaper is already wet. Yeah.
So it's interesting. Next, we're going to do show you, mom. It's very important. You have a good diaper. At the same time, you must know how to apply it correctly. If your technique is all wrong, then your baby will cry, a lot because of discomfort. At the same time, you may have a lot of leakage, and baby may feel uncomfortable. Sometimes too tight, it may lead to what we call vomiting, like a projectile vomiting. Just like you, sometimes your belt is too tight. Then after you have a buffet, then you feel like throw out, so you have to loosen your belt. The same. The baby needs to be comfortable and able to wear the diaper in the correct manner. Example, you wear your underpants, which is too tight and wear wrongly. You think you can sit hold it? No way. Okay, so let's show you now. Very, very critical. That is a bag. All everybody know. So open up, pick the baby's leg. You don't need to roll the baby sideways. Baby will cry a lot. Like, don't disturb the baby so much. So gently lift it up and slide it in. That's all. Half an inch, you slide it in and it's done. Always make sure the back is at the top. Later on I'll show you. And it's baby never, enjoy drop waist pants. They're not fashionable. I find that caregiver, secondary caregiver, nanny like to let baby wear G-string. That is called G-string. It's very uncomfortable. Alright, so don't let baby wear half the diaper roll down and then expose the coat like this. Although it's breathable diaper, sometimes it will trap the urine and then it make the baby get a rash across here. So what we have to do is open up, don't rush, hold it, and then just remove the sticker and then undo the sticker. Make sure it's comfortable, tear across. And at the same time, this way and put across. Then we roll this diaper down. Then the cord can be exposed and it's neat as just 2 or 3 fingers. Most vital is the legging. Make sure this legging actually, the frill are actually roll out, and then it actually prevent leakage and it adjusts about last little finger. That is very important. Now, basically, the baby look very good, and then from the back, I pick the baby out and let you see, and it's very comfortable, neat, and good.
And not too tight, like you mentioned
Yeah.
just now, because it's very uncomfortable for the baby, right?
No.
Yeah. Same for adults as well. When you're too tight, the pants is very uncomfortable. But
You
sometimes
can't
we
even
see,
walk,
Yeah.
especially when you sit down.
Yeah.
And especially when baby, before feeding, the abdominal muscle is not fully developed. So when they eat, the abdomen actually pop,
gets
expanded.
bulked, yeah.
So if it's too tight, then you become like a too tight. It cause the baby food to reflux back. So become can be actually lead to vomiting. It's not necessary.
Okay.
Good.
Okay.
So
So this is where you apply some of the moisturizing
That's
lotion.
right. And then you can do a bit massage, you pick up some skill and then
Touch therapy,
Yeah,
right?
correct.
Dr. Wong created
So-
the baby massage touch therapy, I remember.
correct. And babies like to be touched, which is most important. The touch must be very, very, you put cream this way, it's a form of touch. Then you actually can stroke the baby, the cream, and then rub this. And this is the form of the massage. But you can always book back to do a proper massage, which actually calm the baby down. And the baby sleep better, sounder. At the same time, baby skin become improved, less allergy. And at the same time, they actually good response, bonding with the mother. I do a lot of chest exercise as well. So then they got, lower risk of catching flu.
Oh, okay.
Yeah. So basically, all these are important. To dress the baby, no hurry. Cottony is the best. So what you have to do is open up, stretch, then you actually look from the head, the chin, all over the head, and it's down. That's all. Okay. If you got any stretch, these are stretching things. To wear the sleeve, always apply. Picture out, and the baby is just go in. The same way here. All you have to do is all cottony stretch. Picture out, put his hand in, and then we're actually done. Always I like to hold the baby's hand because the fingers are all flat, and then in case you bend the finger too much and cause some injury.
Or some injury to the baby's
Yeah.
fingers, because they're so delicate, the fingers, right?
Correct.
Yeah.
So what you do, just pull the front and the back, just give a quick pull and it's done. And the baby is very comfortable and it looks good and it's smart. Then tidy up and then the baby's ready to go out.
Very nice. Can we take a few questions, Dr.
Yes.
Wong? Okay, I have one from Audrey Ma.
Hmm?
How do we care for post-circumcision for baby boys?
Okay, circumcision is done purely based on personal preference and religion. So the one actually circumcision is done, the foreskin is rolled back. What you have exposed is the penis tip, and it can be very bruised. But baby don't feel much pain, they do pee very well. So if there is a stitch, then we'll leave them alone, then let them soak in the water. Once the stitch drop off and the penis tip is exposed, it's fine. If you got poo, you clean the same way. If no poo, just leave it alone. It should be fine.
Okay. From Lara, what can we apply to baby after a bath?
Anything that you have, the baby products, like which is very important, that which is specially designed and manufactured to suit their sensitive skin.
Okay. Mummy Vivian is asking, should we use baby face and body lotion? Which I think Dr. Wong did mention a few times that
Yeah.
it's good to apply.
If you have, and then as long as it's baby products, and then you apply a little bit first in case it triggers sensitivity. Same product, some baby skin is a bit sensitive, sometimes baby may have acne, or even what we call the face got a little bit of what we call the
Eczema.
eczema, correct? So we have to leave it alone, we don't apply anything.
So for eczema, don't apply anything.
Acne also leave it alone.
Okay.
Unless it's very severe, then doctor pediatrician will actually give you some very mild steroid cream, like prednisolone. But otherwise, no need.
Okay.
All right, some breast milk can be used, like that a little bit.
Right.
But don't need to put any cream on
Unless
the
it's
face.
very serious, then you bring to the pediatrician to
That's
have a
right,
look.
yeah.
Okay. Mommy Tiffany is asking, do we still have to put moisturizer when we already put diaper rash cream?
Good question. Diaper rash cream, I only use it purely for diaper rash. Maybe for changing, every change, I use a bottom bumps. Why is that so? If I keep using diaper rash cream, when baby don't have a diaper rash, then when actually baby got a diaper rash, the cream may not work anymore. It's immune to it. So the choice is yours, and this is the rationale. So use the two different types of cream. One for just as a balm protection.
So a barrier cream.
Correct.
So bottom balm can also means barrier cream. Yeah, and then diaper rash cream is, you were saying, the kind that's for treating diaper rash.
Correct. And after using the diaper rash cream, 24 hours to 48 hours it should clear. So change the diaper, let it air, keep the diaper area clean, and to prevent the ammonia irritating from the urine irritating the child, and also the acid from the pool that we can burn the skin. So that create what we call diaper rash.
Okay, so these are all the factors that cause diaper rash. So like Dr. Wong just mentioned, always change the diaper regularly. Make sure that the skin is kept clean and dry and protected from the urine, from the poop. And of course, not forgetting that we should use a very good quality MamyPoko diaper, which is MamyPoko Natural, made from organic cotton top layer, and also contains 3 essential oils, as well as made from 3 natural plant oils, and made from additive-free ingredients.
Very important. And it actually can soak up a few weeks, and the diaper is important, that top layer remain dry. I have done a lot of demonstration before. You can pour about 60 ml of water into the diaper, and then after that, that's equivalent to at least 4 or 5 p, and then you touch. After that, it's still dry. It's important. So they keep the skin dry.
Right.
Okay.
So something that's very absorbent and yet breathable.
Correct.
Yeah, so that the bacteria doesn't gather inside the diaper, right?
And cooked up a diaper rash.
Okay, and Mummy Joyce is asking, is it a must to apply diaper cream after every diaper change? So Mummy Joyce, I think Dr. Wong already addressed this. She said to apply a barrier cream or a baby balm, and then only if there is a rash present, then you apply the diaper rash cream.
Correct.
Is that correct?
If after 48 hours and the diaper rash had gone worse, then I think it's good to see a doctor. It's more serious than what you think. It can be candida.
Oh, candida. What's that, yeast infection, is it?
Yeah.
Candida, okay. Okay, so a mom is also asking, this was one of the questions written in. Dr. Wong, hi, is it safe to use baby oil or olive oil on baby's head and body on a daily basis after bath?
Oh, good question. Olive oil has an exfoliating effect. That means it remove the skin. So first day, if the baby born got a lot of dry skin, olive oil can be applied. Baby got cradle cap, which is created by mother using too strong a shampoo, then you can use cradle cap. Right. But for daily basis, I will use something less that effect. Otherwise the skin become too thin. So you can use any baby oil products is good enough.
Right.
Yeah.
Right.
Olive oil only specifically for certain reason.
Okay.
Yeah.
Okay. Thank you so much, Dr. Wong. I think let's take a seat maybe and address some more questions, and let's go through a bit of theory as to why, what causes diaper rash, how do we prevent it, because I think a lot of moms would want to know how it's caused. So maybe you have a seat here, and you carry baby.
Yeah, you got black nose.
Okay, so Dr. Wong, you will sit here while I move this away. Thank you. Okay, so Dr. Wong, can you briefly go through with us again what are the different causes of diaper rash?
There are many reasons for diaper rash. It's sometimes baby can be soaked, like you say, in a pee for too long, and those diapers are no good. And then the ammonia is irritating, constantly rubbing, and so some are quite rough. And also the material is quite rough, it will create like abrasion. And sometimes too tight, then it cut into the groin. That will create some form of a rash as well, because it forms a reaction to the to the skin. At the same time, is people cleaning? Again, you don't clean it in the correct manner. You scrub and scrub, and the poor little baby bum will be all cracked.
Right.
I have one case. The anus area was all cracked, and the blood do come out. So I be careful.
Okay.
So sometimes people thought they scrub harder will be better. It's not necessary. Clean it in the correct manner. Clean it well, thoroughly, and you'll be fine.
Right. So
Let
I
it
remember,
add.
and Dr. Wong also mentioned to remember to clean from front to back.
That's right.
Yeah, always the genitalia first, and then the anus will be the
The
last. of it.
Correct. Good.
Okay. So if a baby is having diaper rash, how do we treat it? That means the rash is already present.
Yeah.
We've already gone across the line.
Okay, once it cross the line, diaper rash is the best is to let it air. Keep it dry and clean, let it air. You can use some cream and then let the baby do a bit of tummy time, air the back, and then lie on his back to air the front. So he can wear a shirt, roll it up, and then put a diaper underneath, and then let it air.
Just let it air out.
Yeah.
Okay.
So again, that would be much better, and then keep an eye on it and find the cause. What is the reason? So if you're able to find the cause, treat the cause. After 48 hours, I would say 2 days later, if you seem to get worse and it affecting the baby and it's very irritable, baby is crying a lot, moan and groan, I suggest that maybe just seek doctor's
Doctor's
advice
help.
to get some cream.
Right.
Yeah,
Okay.
that's a cream.
Okay. Mummy Yen Yen wants to ask, may I know when is the time to change the baby's diaper? Is it pee one time, then you change the diaper? Or is it accumulate until completely full, then we change?
Pee alone, because it just, like Jen said, this diaper is so absorbent, the top layer is always very dry. So you don't need to change straight away. But it's pool, the acid there may sometimes too explosive. Right? So it's too wet, sometimes it's a very liquidy, it may seep through. Right? But unless you got very good diaper, it may absorb it back. So the good practice that whenever there's a poo, I would like to change the baby.
The poo is for sure.
Yeah.
Poo is for sure. It's so smelly, you want
Yeah.
to change for sure.
Yeah, for pee, you can even wait, 3 pee is fine.
And I think that's why I'm so impressed with the MamyPoko natural diaper, because one of the special features that I mentioned earlier, if I can have the baby, is that, see, I become a bit pro after I learned from you so much.
Yeah.
So the good thing about the MamyPoko natural diaper is that it comes with the special feature of the triple wetness indicator lines. So that means you don't have not 1 but 2 but 3 lines. So you don't actually have to unbutton the entire romper. All you have to do is just peek from the side to see, oh yes, okay, one of the lines is already colored, so I can actually change the diaper. Yeah, so this is one of the features that is very special to MamyPoko Natural. And for you mummies out there, if you are keen to get your hands on a sample, expectant mums for example, you would like to try a good quality organic diaper from Japan, you can always sign up for our samples at mummysmarket.com.sg for MamyPoko Natural newborn sample size. Okay, I'm gonna give it back.
I don't mind trying.
Okay.
Alright.
For your grandchildren.
Yeah, very important, as I say, mom up there, the baby's skin is very delicate, okay? And the skin is very thin compared to adults. But as they grow older, they become more resilient, so tougher. So, I think it's good to pay attention to the diaper and the quality of the diaper.
Right. Oh, and not to mention, for 3 of you lucky viewers out there, 3 of you will stand a chance to win 1 carton of MamyPoko Natural diaper each worth $104. All you have to do is like and share this live video, as well as let us know in the comment section 1 good feature of MamyPoko Natural that you really like. And we will choose 3 lucky winners after this live video. So make sure you leave us a comment and let us know one of the features that you like about MamyPoko Natural. Okay, let us go on to another question. Now I have a mom who is asking how to deal with babies' face rashes that appear almost every other month.
Baby do have sensitive skin. Don't forget again, water error, you need some adjusting. So what we have to do is, don't over rub them, don't always wash them too often. Alright, when you wash the face, always that dry. Don't keep it too wet.
Right.
And then keep an eye, and then if it comes on and off, sometimes it could be itchy rash. So I wouldn't worry. It's transient. It will disappear by itself.
Okay.
Yeah, as the baby grow older, so just generally monitor. And if it's allergy, of course we can tell straight away. So if you're not sure again, ask us. You know, you can log in and ask us. If we are concerned, then I say to you, oh, go and see your pediatrician. So you can always send a picture. Then we are always, you know, sharing and caring. So I'm in between all the doctors. So I'm just helping you, you know, to reduce your worry as much as you can.
Okay. I think you have a lot of mothers who are always writing into you,
Correct. What's that?
messaging you in the middle of the night, very
Oh yeah,
worried.
the other night I just got 3 o'clock, a mother calling me.
In the morning.
Yeah.
Oh, 3 o'clock in the morning. Wow. See, a mother's life is very tough. It's 24/7. What was she calling you
She
about?
was a bit upset because she thought she got a baby not drinking, and she thought she got very bad engorgement.
Ah.
And baby was crying.
Okay.
So she was very concerned. Baby also a bit jaundiced, and she and her husband couldn't decide what to do. And then, you know, like young parents, they tend to get too worried.
Yeah.
And the more they discuss, then the more they search.
Yeah, and then you Google and you find all these scary answers.
Yeah.
Yeah, okay, but this is a totally different topic altogether. Dr. Wong is very well versed in anything to do with pregnancy and after birth. So that's why you should join us next week, because we have Dr. Wong back with us again as we discuss tips on breastfeeding and going onto your breastfeeding journey. Okay, do we have any more questions from the floor? No? If not, let me just share with you a little bit more about our MamyPoko natural diaper, if I can have a sample over there. So it's Japan's first organic diaper. You can even sign up for a sample now for newborn size at mummysmarket.com.sg. The wonderful thing about this diaper is that it's made with organic cotton, so it's very natural, very soft for the baby skin, very reliable as well. And it's made with organic cotton on top, very soft, very nice. It also contains 3 natural plant oils, jojoba, rice bran and olive. And it's also made with additive-free ingredients. And as I'm touching it, I can feel that it's so soft. It's looking very pure. It feels very light, breathable and airy. And the wonderful feature about this is that it also has the wavy absorption zone at the back to catch all the punamis that are very common for breastfed babies. I think even babies who are being fed formula are also they also can have punami lah. So this is available. This is a feature available in newborn and small size, and also not forgetting that we have the triple wetness indicator lines, which makes it very easy for mummies or daddies even, because Dr. Wong likes daddies to change diapers.
Yes.
Yeah, to peek from the side, and you can see that it's time for a change. So head on to mummysmarket.com.sg to sign up for a free sample if you already haven't. And once again, I would like to thank our very, very beloved baby whisperer, Dr. Wong Boh Boi, as you've shared so many wonderful tips for new moms today. I think we can even check out for more details on very detailed step-by-step bathing, changing, diapering, baby massage. You can always feel free to consult Dr. Wong and attend a class with her.
Yep.
Many of her students have benefited, and I think one thing is good is that you always place the emphasis for the father to learn as well, so that it's a 2-in-1 effort instead of just, it took 2 people to make the baby, right? So
Correct.
2 people should take care of the baby.
Share the load.
Yeah.
And you enjoy them together, and you can actually talk about the baby, what baby can do, rather than worry about baby. Today I have a baby 2 months smiling. The mother was so shocked. Yeah, in the clinic. Baby smiled. She said, how come baby smiled to you and never smiled to me? I said, because sometimes you're overwhelmed by your daily stress.
The baby can sense it, I think.
Yeah.
Right?
So then when I'm very relaxed, I'm smiling, the baby thought, mirror effect. I also smile back. This, a very pleasant lady, and that's it. So enjoy the child, father. Place your enjoyment, talk to baby, and then naturally, focal length is very short, so about 10 inches, look at the baby, newborn baby, they cannot to look too far, and then naturally you're able to bond with that child, and it's much better.
So always communicate and always talk to your baby whenever you are doing your bath routine or your diaper changing routine. Keep it as natural as possible, of course, and always communicate with the baby and make it a very pleasurable experience for both you, yourself, and your newborn.
That's right.
Alright, thank you so much, Dr. Wong, and thank you, mummies and daddies, for joining us today. We've come to the end of our session. If you'd like to hear more from Dr. Wong, of course, we have her back with us next week as we talk about breastfeeding, and she shares her breastfeeding tips with us. And if you haven't already, leave us a comment and let us know, one of the wonderful features you've learned about MamyPoko Natural, and you may just be one of 3 lucky winners to walk away with a carton of MamyPoko Natural diapers, Japan's first organic diaper, worth $104. Alright, we'll see you next week for our next live session. Thank you again, Dr. Wong.
Hey, thank you,
Okay.
and thank you all of you. Stay safe and then enjoy your baby.
Yes, and enjoy the rest of the week. Bye-bye.
Bye-bye.
Thank you so much, Dr. Wong.
Hey, thank you.
I always